Hi, my name is Dr. Nancy Utley, and I'm an OBGYN physician at the Jackson Clinic in Jackson, Tennessee. Today is March 22nd, 2020, and I'm here to give you some advice, as current as we have it, on what to do regarding COVID-19 and pregnancy specifically. Please note that this is not personal medical advice, but a jumping off point for what to discuss with your physician. First of all, this is a rapidly changing issue, and this advice will change all the time, and we'll try to have updates available as we get them. But for today, this is what we know. Data in pregnancy is limited because this is a new virus, and it takes time for us to know things about like what happens in the first trimester. Babies that are currently in the first trimester of pregnancy won't be born for months, and so that stuff we just won't know for a while. The most important thing for you in your pregnancy, no matter what's going on right now, is that you don't panic. You have great providers around you able to take care of you, and reach out to your healthcare providers if you're panicked or worried. As far as we know right now, based off data of people who were pregnant and positive for the virus at the time of delivery, those infants have not tested positive for the virus. We're hopeful that what this means is that the virus cannot cross the placenta to infect the baby. That's what people are continuing to assess over time. As far as we know, this virus also is not present in breast milk. So for people who have delivered, the recommendation is still to breastfeed if that is your desire for the pregnancy. For people who are persons of interest for infection or who are known to have infection, breastfeeding is still allowed, but the mother is supposed to do everything she can to avoid infecting the infant, including watching what secretions are passed to the infant, such as wearing a mask during breastfeeding and those kinds of things. For people who are pumping, cleaning the pumping equipment appropriately, and allowing someone who is not a person of interest, who is also a caretaker for the baby, to provide that baby with expressed milk. For people during pregnancy with symptoms, the symptoms that we know most people present with are fever, shortness of breath, chest pain, a dry cough. Some people have gastrointestinal symptoms like upset stomach, diarrhea, some vomiting. Most people probably don't have symptoms or have very mild symptoms, which is why we are so strongly recommending social distancing at this time. So the thing to do if you have mild symptoms is to contact your healthcare provider and let them know. If you have severe symptoms or those that you think you need to be seen for, it's very important that you contact your provider before you present for your visit to let them know your symptoms, so that you can be appropriately handled, so that the healthcare providers taking care of you can protect themselves, and so that other patients can also be protected against your symptoms to help prevent the spread of the virus. Same thing if you have symptoms where you think you need to be hospitalized or seen for labor at your local hospital. It's very important that you let people know before you come in the door what your symptoms are so that we can protect everyone. Some things may have changed at your local hospital. At our hospital, we deliver at Jackson-Madison County General Hospital. The current recommendation for everyone who is in labor is that they are only allowed one hospital visitor. From the time they come in labor to the time they leave with their sweet baby, only one person is allowed in the hospital. It's the same person, and that person can only come and go from home. The reason we do this is to protect you and other patients against other people in the community who may have symptoms and bringing that to the hospital, but also to help prevent spreading that from one patient to another within the hospital system. So what can you do at home right now? Take care of yourself. Get lots of rest, drink lots of water, enjoy the time that you have with your family. You'll never have another opportunity to spend this much time in communion with your family. Take advantage of these things. If you begin to have symptoms again, don't panic. There are a couple of things that are recommended to help decrease your chance of infectivity. One of these things is zinc. There's not a recommended dosing, but in general, recommending 2 tablets daily. Also, vitamin D3. 4,000 international units daily is recommended. As far as we know, pregnant women are no more likely to get this virus than people who are not pregnant. Also, we do not know whether pregnant people are more likely to get sicker with this virus compared to people who are not pregnant. What we do know from previous experience, one of the reasons we recommend influenza vaccines so significantly is that pregnant women are more likely to get more sick with respiratory viruses like influenza. This was also seen in the previous SARS epidemic, that pregnant women were more likely to have worse symptoms and to have worse outcomes because of this. So in general, we are treating pregnant women as they may become more likely to have worse symptoms with this virus. The only thing that is known to be more likely right now with this virus is there's an increased chance for preterm delivery. But in general, we see this with people who have medical problems anyway and infectious issues anyway. So this may not represent specifically the virus, but just may represent the overall inflammatory state of pregnancy when you're sick. And for people who are healthcare providers and who are currently pregnant, the recommendation, if personnel allows, is for you to avoid contact with persons under investigation or persons who are known to be present for COVID-19. Use general precautions and use the appropriate personal protective equipment as recommended. 2 places that you can go for updates as quickly as I would have them to give to you are, first of all, the American College of Obstetricians and Gynecologists, or acog.org, acog.org, or second of all, the Center for Disease Control, cdc.org. As soon as we have new updates, we'll try to update them on here as well. God bless you and stay safe.